Hi, darling. Welcome back. Have you ever been shouted at and told to sit down as if you were a child at a public hospital or a clinic by a nurse? On today's video, I want us to talk about why is it that a lot of older female nurses tend to be very rude. And the unfortunate thing is, this is very common. There are many amazing nurses in South Africa who become overshadowed by the bad apples. So what I want to talk about today, why is this the case? What we're going to do today, we're going to watch videos that highlight the experiences of patients. We're also going to highlight some comments by patients as well. And then we're going to go through the side of the nurses. We want to hear it out. Why is it that a lot of nurses in South Africa have a lot of similar patterns across the country? We're also going to figure that out. And then at the end, we're going to figure out what is the way forward. Is there a way forward of preventing this poor service within healthcare? So there's a video that really inspired me to have this conversation with you, and I will also share my experience after we read the comments and go through all the videos. I will also share my own personal experience briefly within the public healthcare system. So here is the video.
I want to talk about an underlying issue that is mostly ignored in South Africa. I don't know if it's ignored or it's just being swept under the rug. You understand? In public hospitals and public clinics, like things that are under the government, you will find most female nurses, and I'm not saying this just to bash women or anything, because I'm not one for bashing women. You understand? But this is kind of a universal experience for every woman. And it's also especially the older generation, the millennials. And I'm not saying maybe you'll find, I don't know if the Gen Z does that, but for me, I haven't experienced any Gen Z female nurse being rude to me. But you will find the millennials, the older women, being so rude. I don't understand the science behind it. Can somebody please explain? They are so rude to women, mostly that are looking for healthcare. A woman will come to the clinic looking for contraceptives, or coming to check for pregnancy, or maybe just, doing normal checkups, and they will be so rude to them. Or even worse, a woman giving birth. That is the one that pisses me off the most. I have heard women horror stories about nurses being so horrible to them, nurses, female nurses, because they, will be in the theater mostly when a woman is giving birth. That's what I know. The stories that I've heard about them female nurses being rude, guys, it's terrifying. It's terrifying. What do you mean that I'm in my most vulnerable state, mentally, physically, and emotionally, and you're here, you're attacking me, you're telling me the way I should open my legs, the way I open my legs for that man, you're telling me you didn't send me to go and have sex with that man. What are these things? Are those things necessary? On the time that I need you to be gentle with me, on the time that I need a woman to be by my side to comfort me, you understand? Because I'm giving birth, something, I'm bringing life onto this earth that can literally result into a matter of life and death. You understand? And you'll find most of them being so horrible. I literally do not understand the science behind it, guys. Oh my goodness. Or maybe you'll go to the clinic looking for contraceptives, birth control, and stuff like that. And they will low-key judge you and ask you those questions subtly. They'll make you feel kind of ashamed to even go to the clinic to actually ask for contraceptives and everything, because they'll be even plain rude to you. Or something. You understand? And I'm not saying male nurses are not problematic, because they are, Leone, they are problematic. And I know maybe some people have stories of male nurses being problematic, you understand? But I really want to understand the science behind it, because there's no way. They need to do better. And the way they will be judging women for their sexual activities or stuff like that. I can't giving advice, but like, some literally you can see it's coming from a place of bitterness, and I don't know why. Because I come here looking for contraceptives, I come here looking for birth control, I come here looking for healthcare, but you are here judging me, you are here scrutinizing me, and I can't. Why? Like, they need to do better. They need to get out of that bitterness stage. I don't understand what makes them like that, but they need to stop.
Under that video, there's also comments of patients sharing their own horrible experiences within the public healthcare system. The first comment is by Khomolimo. It reads, I went for a termination last year. The older nurses forced me to look at my fetus. I still can't get it out of my mind till this day. Fatima took my sick 2-month-old baby, and as I was explaining, I mentioned how he never slept the whole night. Her response was, where have you seen a dying person sleep? Tule, who's also a nurse, says, they even bully us young nurses. Anati, I was 21 when they let me give birth to my premature baby on the floor by myself. Laura, I was asked to clean the floor when my water broke. And when it was time to push, they told me to wait, and I couldn't stop myself from pushing. So they said they will leave me to give birth by myself. They also had a problem with my Ted Baker bag that I used for my clothes. Apparently, I was acting classy. The last one is from Melanie. It's so sad to the point that when you experience a nice professional nurse, it is shocking. There's also people within the healthcare profession that ask similar questions. Here is another video.
Hi everyone. I have a question for the nurses. For those of you who know that I'm currently in the rehab, I am in the rehab here in Cape Town. I have a question for the nurses. Not everyone, but some nurses. Guys, what happened to respecting people? What happened to being a human being? What happened to treating people how you want to be treated? What happened to doing your job, what you are getting paid for? What happened to what's with the attitude, guys? What's with the attitude? Like, I don't understand. I can't even speak. I've been noticing this for since I started in the hospital in Somerset West, and now that I'm in this rehab, I've noticed the trend.
So the nurse who allegedly mistreated a 50-year-old patient that died a few days after the incident has taken 2 weeks leave as an investigation into her conduct is underway. The deceased, Lydia Makhubo, was admitted to hospital for diabetes and hypertension about 2 weeks ago. The health department in Mpumalanga says an autopsy has been done and it's now waiting to find out what was the exact cause of death after a video of the patient came to light. News from Africa's Moili Masilela has the story.
The death of Lydia Makhubo, 5 days after she was allegedly mishandled in this hospital, has left her family angry and frustrated. A video of Makhubo that circulated on social media showed her half naked on the floor next to her hospital bed. According to the health department, Makhubo was trying to reach to the restroom to relieve herself after asking a nurse to assist her with a bedpan. It's alleged that the nurse that was on duty mishandled her on the neck after she already messed the floor.
The nurse that will be disciplined has taken 2 weeks leave, and the hospital has actually now written to the HOD to request approval for the processes to start. And also we are working together with the SAPS where a case has been opened for an inquest, where an autopsy has already been done, and then we are waiting for the results to come out. That will show exactly what was the cause of death. That on its own will make sure that the processes goes together. So whatever finding that will come will also inform the outcome of that disciplinary hearing.
The Democratic Nursing Organization of South Africa maintains that healthcare workers can't be blamed.
We firmly stand with the nurses, mainly because we've been saying to the Department of Health that the staff shortage will lead to such incidents. Because if you listen to the story and you follow it, you will see that there was nothing bad that the nurses did, but it was an issue of how they picked up the patient. And if there were enough nurses or personnel in the ward, they could have assisted the patient way better. So we are still going to continue and advocate and say Department of Health must employ more nurses in the different hospitals.
The family of the deceased and community members are demanding justice.
Sifuna justice netimpendulo kulo nesi ukuthi noma ngabe ukuhluthuka ipatient akhe angayitreata the way ayitreate ngakhona na, if bekungima kwakhe uyatomtreata the way amtreate ngakhona makwethu na. Thina namhla sila sisemandini yena ukhona ukwakhe unaye maybe makwakhe.
Sibita bonke abahlali basenkomazi ukuthi asiyunayitheni sibumbane sibe munye, then sihambeni siyomacha. Sifuna lishintsho kulesa sibhedlela, sifuna lo lokwendekile kugogo asisafuni kuphinze kwendeke kulomunye. Lokho sitokwenda ngokuthi sibambisane sonke sibahlali basenkomazi.
Like the unfortunate story of Lydia Makhubo, there's a lot of sad stories when it comes to the treatment that patients get. There's a lack of empathy from nurses in the hospitals and clinics. There's a level of attitude that nurses, especially older female nurses, tend to give to patients. And I know that there's probably stories of male nurses, but majority of these experiences are from female nurses because it is a female-dominated industry. There's a lack of empathy. You get treated as if you're an idiot. The way, the tone, the attitude is so condescending, and the lack of empathy is appalling. I want to share my story before I go over the experiences of nurses. Here's the story. I was 16 years old. It was winter time. My family had a paraffin heater, and they used to put a pot on top of it so that there'd be water inside the pot that evaporates to prevent us from getting headaches. Because if you put a heater inside the house, it makes the air very dry. So you have to add moisture to the heater. So we used to use that. I was 16 years old, and I remember I was removing that pot from the heater while it was still hot. I tripped and fell. The water splashed on my forehead. I had a huge, pink area on my forehead because the water had splashed on my forehead and on my arm. I went to the clinic to get assisted for that. I remember my brother drove me to the clinic. I went to the clinic to get assisted. And it was such a contrasting experience because I both had an experience of a horrible nurse and an amazing nurse on the very same day. So there was a nurse who takes people's BP, blood pressure, and on my arm, this part of my arm had been burnt. It had water splashes on it. So I told her, please just hold this area. Don't hold the lower part of my arm because I've just got burned there and it really hurts. I asked her to not touch it because when you do someone's BP, you don't need to hold the entire arm. You just need to hold the top part of the arm. Did the lady care to listen? No. She grabbed my arm roughly to a point that the skin that was on my arm, I'm sorry to trigger you, it peeled off. The skin on my arm painfully peeled off. And she wasn't even wearing gloves on top of that. So she peeled off my skin while trying to take my blood pressure. And she didn't even apologize for it. By the time I got to get my dressings done inside a different nurse's office, That lady was amazing. You could tell that this woman was built for this. This is her calling. She was supposed to be a nurse. The nurse who helped me with dressings was absolutely amazing. She talked to me, she was kind. I looked forward every time I had to go to her to get a dressing. Not that BP nurse. That lady, her treatment was absolutely evil. But the nurse inside who helped with my dressings was absolutely amazing. And these stories, just like mine, are way too common in South Africa. Almost everyone has a horror experience of going to a public hospital. People even have anxiety to go to a public hospital or a clinic because you already know what's going to happen when you go there. You already know you have to deal with the attitude. And even if you try to fight back, the nurses will either slow down on serving you, they will make sure that you are the last person to get service if you even try to talk back. So I'm very aware of the fact that nurses are human too. So what is it? Why do nurses behave in this way? And I was reading a few comments, and a lot of them were talking about the fact that it's burnout. They are experiencing a lot of burnout. There's a lot of trauma and desensitization that they go through. So imagine a person who sees people dying every single day, who sees injuries every single day. That person becomes so used to death to a point that they don't feel a state of emergency because they already know some people will eventually die. There's a level of desensitization. There's also certain power dynamics. A nurse, when you are in a public hospital or a clinic, the nurse has power over you, and some people just don't know how to deal with power. In that moment, when you're sick, when you need them to help you, they are in a position of power because you have to go through them to get service, to alleviate your pain, to end your suffering. There's something also unique to the South African context, and that is cultural hierarchy. So in African culture, older women are seen as authority figures. There's a level of respect that is supposed to be given to older women. And the problem with that, some women take that cultural element and bring it into the clinic. So they expect every single person to respect them. They expect even the younger nurses and the younger doctors to respect them not because they give out respect, but because they expect to be respected, even if they are not respectful. Because in African culture, there's a belief that if you are a nurse, if you're an older woman or an older man, you are just supposed to be given respect. You are not supposed to earn respect. So there is also that cultural element. But also, I think it's also because within the nursing industry, within public healthcare, public clinics, and hospitals, there's a lack of accountability. Even if there's a complaint box, the complaint box is useless. You can put in your complaints, but there's a huge lack of accountability within the hospitals. Some nurses won't care that you feel a certain way about their service because it's not going to save anything. They know that they are needed within the public healthcare system. They are needed. So there's a level of arrogance that comes there. But there's also, I feel like there's something particular with older female nurses in South Africa. Obviously, not all of them. I think some nurses are absolutely beautiful. Like the story, my personal story, and other people probably have experiences of good nurses. But some people, especially the older generation, the boomer generation, even older millennials, they only took nursing because there were no options. They took it as the only viable option to getting a job, not because it was a calling, but just because they wanted to escape poverty, they wanted to escape hunger, and that seemed like the only career option that accepts a lot of people if you study it. So a lot of them didn't choose nursing as a passion. They chose it because they know that they will be able to get a job, they'll be able to survive. So that was a huge thing, especially in the 90s and early 2000s. To just take a job as a nurse or a teacher, especially in the Black community, you were guaranteed to have a job. But I also think there's another side to nurses that we don't experience, the human side. As much as nurses are, some of them are horrible people, we can't blame all of them because they also have to go through a lot of things. They go through experiences such as being overworked. They are overworked, they are understaffed. In the South African context, according to the South African National Nursing Council, for every one nurse in South Africa as of 2022, one nurse has to serve 224 patients in the South African context. And it's no wonder that we all have such bad experiences, because even the recorded bad experiences was the fact that in 2009, poor experiences within the nursing industry were about 4,170 in Gauteng province. And then by 2020, they had increased to 4,701. Imagine what the number is now. So yes, I feel bad for nurses, but I also feel bad for patients. And I just feel like you shouldn't be allowed to treat people badly just because you have your own issues. There's a human side to nurses, I get it, you're human. But the same way a corporate person knows not to bring their anger issues from home. When you work in a corporate environment, you can't bring your personal issues to the office. You know how to humble yourself to your manager, to your boss, to the clients. You're not angry and mean to the clients. But that seems to be a culture within nursing. I get it. The human side, nurses are overworked. They have to deal with broken equipment. Sometimes they even get delays when it comes to payment for overtime. They have to deal with the fact that there might be shortages of equipment, shortages of medication. And who do patients look at? Patients look at nurses as if they're the ones who control medicine. They're the ones who control the equipment. They don't know. They are the ones. They deal with the shortage. They know that there's shortages in the hospital, but the people who get attacked for shortages are nurses. So obviously you can imagine that they are also human. They are also emotionally exhausted, but also patients are human too. And they are also in pain. They are also going through their own things. I get it. There's a human side that we have to acknowledge when it comes to nurses. It shouldn't stop you from doing your best to help your patients, because in my belief, being a nurse is a calling. Not everyone is meant to be a nurse. It's a calling. That's why we are having nurses who are extremely horrible, because it wasn't a calling for them. It's just a career. So how do you move forward? How do you move forward? And unfortunately, everything leads back to our politicians. The 2 billion rand that was stolen recently by politicians, your Cat Matlalas, all these people who are involved, they are the reasons. It's politicians. That money could be used to employ multiple nurses, multiple doctors. That is what we need. We need more nurses and doctors in hospitals. They are not supposed to be unemployed. That is an actual solution. So if you are part of the government and you're listening to this, I don't even think I need to be advising people, but the government knows that the only way to deal with the lack and the poor service is to provide the money that is needed for hospitals, not the looting that happened in Tembisa Hospital. We need to provide enough money for the hospitals. The government needs to provide enough nurses and doctors within the hospitals. But I also just say the only solution that we have now, an immediate thing that I think we can do now, is respect. Respect goes a long way. Nurses should learn to respect the patients, and patients, you have to also respect the nurses. because they are also under pressure. You're also in pain. Respect is a two-way street. Some nurses are very disrespectful and respect is earned. So respect is one thing we can try and implement right now. The other problems are bigger problems that the government has to sort out. The government has to sort out. Employ more nurses, employ more doctors, employ people. That is the only solution that is going to fix a lot of our issues within the South African healthcare system. I also want to hear your experiences. How do you feel about nurses? How do you feel about the public healthcare system in South Africa? Have you had your own horrible experiences? And if you got to the end of this video, please leave a needle emoji in the comment section if you got to the end of this video. And I look forward to hearing your feedback, darling. Bye-bye.